In the early 20th century, a mysterious epidemic swept across the globe, leaving thousands of people in a state of perpetual sleep. This is the story of encephalitis lethargica, also known as the sleeping sickness. First identified in 1917, encephalitis lethargica struck suddenly and spread rapidly. Cases were reported from Europe to the United States, predominantly affecting young adults. Victims would fall into a deep, unresponsive sleep that lasted for weeks, months, or even years. The outbreak of encephalitis lethargica began during the final years of World War I, a time when the world was already grappling with the devastating effects of the conflict and the Spanish flu pandemic. This new illness added another layer of fear and uncertainty. Doctors and scientists were baffled by the symptoms. Patients would often exhibit high fevers, sore throats, and lethargy before slipping into a prolonged sleep. Many who survived the initial onset were left with severe neurological impairments. The epidemic spread like wildfire, with thousands of cases reported in a short span of time. Hospitals were overwhelmed, and doctors struggled to find effective treatments as the death toll mounted. Encephalitis lethargica was a complex and multifaceted disease. Its effects were not limited to prolonged sleep. Many patients experience Parkinsonism, a condition characterized by tremors, rigidity, and postural instability. The neurological effects varied widely. Some patients developed severe psychiatric conditions, including psychosis and catatonia. The disease's impact on the brain was profound and often irreversible. Treatments ranged from experimental drugs to electroconvulsive therapy, but success was limited. Many patients faced a lifetime of disability, with only a fraction ever fully recovering. Despite extensive research, the exact cause of encephalitis lethargica remains unknown to this day. Early hypotheses included bacterial infections, environmental toxins, and even autoimmune responses. However, none were conclusively proven. Some researchers suggested a link between encephalitis lethargica and the influenza virus, given the timing of the outbreaks. Yet, no definitive connection was established. Researchers also explored the possibility of an autoimmune reaction, where the body's immune system attacks its own tissues, but the evidence remained inconclusive. The mystery of the disease's origin persisted, leaving more questions than answers. The social impact of encephalitis lethargica was profound. Many survivors were left with lifelong disabilities, requiring ongoing care and support. Families were burdened with the responsibility of caring for their loved ones, often without adequate resources. Institutions struggled to accommodate the increasing number of patients needing long-term care. The epidemic not only affected the health sector, but also had significant social and economic ramifications. Communities came together to support those affected, with charitable organizations and local governments providing assistance. Despite these efforts, many families faced immense hardship, highlighting the need for better healthcare infrastructure. Today, encephalitis lethargica remains a medical mystery. Sporadic cases still occur, but they are rare. Modern medicine continues to study the disease, hoping to unlock its secrets and prevent future outbreaks. The story of encephalitis lethargica is a reminder of the ever-present challenges in understanding and combating infectious diseases. It highlights the need for continued vigilance and research in the field of neurology and epidemiology. As we remember those affected by this forgotten epidemic, we honor their struggle and the ongoing quest for knowledge. Encephalitis lethargica may have faded into history, but its lessons remain relevant today.